Are you able to see my presentation?
No.
No? Just a moment. And what about now? Are you able to see the presentation?
Yes, yes, sir.
Yes?
Yes, yes.
Okay. Is it full screen now?
Yes.
Okay. Thank you. So, have you all read the chapters I've asked you last time? Chapter 3 and 4? I hope you
Yes.
all have read this because I have prepared a little quiz about these chapters and about all what have we already talked about last time, okay? But for now, I want to talk now about associations with cold and heat, pain associations with cold and heat. It's chapter 7, and please note you will have to read chapter 7, okay? Okay, you understand? Good. So, what I want
Sorry,
to,
Doctor, your presentation, it's uploaded on the drive.
sorry?
Your presentation, it's uploaded on the drive or no?
Last presentation is not uploaded. There was some technical problem, and together with this presentation, what I'm going to talk about today, together I will upload the all together in Drive. Okay,
Okay,
today or tomorrow.
okay, thank you, Doctor.
Okay. So can I start? Shall we?
Yes.
Are you all ready? Okay. So what I want to tell is that mistakes in diagnosis are often made when clinicians approach the diagnosis too quickly without first analyzing the patient's responses to questions, and when attempts are made to make the facts fit a diagnosis rather than make a diagnosis fit the facts. Okay? You all understand this. Pain. What is pain? I want to remind you all. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Okay, I want to remind you about the importance of right questioning. You have all read this in chapter 4. It was very interesting, yes? I must tell you that in everyday practice, as I work with patients, it's very interesting to read all this. Now, maybe you ask question that why you need this to learn to now, and it's a clinical subject. But no, it's very important to understand. Previously what is important to ask, you know, when patient comes in you or you and you look at him, you must all or have all these questions in your head, okay, what you want to ask. And I want to remind you about importance of right questioning. Okay, in the questioning of the patient, it's necessary to establish the site of pain. It's important to appreciate that patients can only report where they think the pain is. This location may not be the actual source of the pain. Pain can be referred from a distant source. Nevertheless, patients must be given an opportunity to describe themselves, both in words and by physical demonstration, where they think the pain is located. Okay? When trying to establish the site of pain, two main questions, remember these two main questions to ask are, where is the pain? Can you place your finger on where the pain is exactly? Okay? Remember these two questions. And also, with all history taking, it's important not only to know what question to ask, what should I ask, but also listen and analyze the response. What does the listen? What does the answer mean? And analyze. What else do I need to know? Okay? Today, we will review the patient's descriptions of orofacial pain, which are associated with temperature changes. Okay? Patients with orofacial pain from a dental cause often report sensitivity to thermal changes. A number of scenarios are possible, all of which have different importance. Okay, pain to cold. Just a moment. Pain to cold. An intraoral pain reaction to a cold stimulus indicates that the problem is dental, almost without exception. Please remember it, and that the pulp is vital. The status of the pulp is difficult to determine from one descriptor alone. However, the severity of the response and the duration of the sensation are factors that help in pulpal diagnosis. Most teeth that are only sensitive to cold are suffering from reversible pulpitis. If the sensitivity is not severe or prolonged, the offending tooth can be identified and cause eliminated. Only conservative treatment measures are usually necessary. And I want to talk about reversible and irreversible pulpitis. Who can tell me what is the difference between reversible and irreversible pulpitis? I hope you all already have learned this. Could you please tell me? No one has answered. No one knows what is reversible and irreversible pulpitis? Okay.
Doctor, reversible, that means that it can be saved. Whereas irreversible, it will be very severe and it can be saved.
Okay. Have you already learned this subject, these topics?
No, it's the first time.
No, first time to hear like that.
So you guys
I, as
haven't
for me,
learned.
I know the reversible pulp we can treat the pulp, not extract all the pulp. And irreversible pulp we should extract all the pulp. That's that I know. Yeah.
This is subject of question on what stage of pulpitis you meet the patient. Okay.
The half I know. Half
Uh-huh.
is this correct? The half
Yes.
of pulp. It's will
Just read
reversible
this.
pulp.
Now, reversible pulpitis refers to instances where the inflammation is mild and
Yes.
the tooth pulp remains healthy enough to save. It's more easier to save the tooth. with reversible pulpitis, okay? And now,
Okay.
irreversible pulpitis occurs when inflammation and other symptoms such as pain are severe and the pulp cannot be saved. Reversible pulpitis usually causes mild pain, as I told you, okay? You may experience pain from eating very cold foods, drinking cold beverages, breathing in cold air, or chewing, okay? So here is a little things about reversible and irreversible pulpitis. I wanted to remind you, but if you don't know yet, please, as I upload this in Drive, please read, okay, about it and remember about reversible and irreversible pulpitis, okay? It's very important to understand then the pain characteristics, okay? Because we are talking about temperature and about pain art, and it's very important to know these main terms. Good. You all have to remember this to learn. Okay, let's go ahead. So we may have bilateral sensitivity to cold. Other than general sensitivity, due to exposed dentin, it's unusual for a patient to have two teeth that respond abnormally to cold, particularly bilateral teeth that respond at the same time. However, it could happen if a patient has multiple caries teeth or bilateral maxillary sinusitis. In both these situations, other signs are also present. Many patients who complain of bilateral pain to cold have already assessed that they have sensitive teeth. Many have been or are being treated with dentin desensitizing agents and toothpaste. So it's about bilateral sensitivity to cold. Now we talk about pain to cold relieved by heat. It's very important, and to understand this topic, it's very important to understand the difference between reversible and irreversible pulpitis, okay? And that's why I wanted you all to remember about these terms. As a general rule, teeth that are sensitive to cold but relieved by heat are far less likely to have irreversible pulpitis than teeth exhibiting a painful response to heat that is relieved by cold. The pulpal diagnosis can usually be determined from the history and the severity of the response. Thus, the problem for the clinician is only to identify the tooth involved. History provides the diagnosis, testing identifies the tooth in question. Cold-sensitive teeth can be easily identified with the use of ice water under rubber dam isolation, isolating and testing each tooth individually. The severity of the pain is determined by assessing the patient's response and noting how long the pain lingers after the cold stimulus is removed. So, asking questions now, about right questions. It's very important. I want you all to remember it's very good. Okay, asking the questions. Is it ouch and gone type pain, suggesting reversible changes, suggesting when you suggest reversible changes in the pulp? Or the second question is ouch and stay type pain, suggesting irreversible pain. So again, reversible pulpitis and irreversible pulpitis. We all have to learn what is main differences between reversible and irreversible pulpitis. A useful method of assisting the patient to explain their response to thermal stimuli. Also, the question, what's the type of pain that you've been experiencing, can help to confirm the identify of the responsive tooth. Okay? What I want you to remember now, with only few exceptions, sensitivity to cold is an indicator that the pain problem is tooth related. Sensitivity to cold indicates that there is vital tissue in the root canal. It's very important to understand. There is no justification for giving antibiotics to a patient with temperature-sensitive teeth. Please note this, especially if there is a history of sensitivity to cold. Okay? Please, it's very important. Remember this topic. So, I want to talk about pain to heat. Now, here. So remember, okay, teeth that are sensitive on heat are most likely to have an irreversible pulpitis. There are no evidence-based data regarding the relationship between pulpitis as responses to thermal stimulation. Nevertheless, it would appear that in the early stages of pulpitis, teeth are sensitive first to cold stimulation, and as inflammation develops and goes deeper and severe, teeth can become sensitive to both cold and heat. In the later stages of pulpitis, heat sensitivity predominates. It's more, okay? Teeth that are sensitive only to heat are more likely to have an irreversible pulpitis. So again, why do we have to know the difference between reversible and irreversible pulpitis to make a right decision and have a right diagnosis, okay? And now pain to heat relieved by cold. Patients who report severe pain from heat are more likely to have teeth with irreversible pulpitis than patients who report pain only to cold. In the later stages of pulpitis, teeth can become actually sensitive to heat, so much so that patients may hold cold water in their mouth or suck on an ice cubes in an attempt to relieve pain where the mouth temperature is sufficient to produce the pain. These patients have an irreversibly inflamed pulp. When a patient presents these signs and symptoms, and if the diagnosis is not clear, methodical testing of all teeth on that side with cold spray and a cotton pillet will identify the aching tooth. In next lectures, I will tell you how to make these cold tests, okay? Relief of pain establishes a probable diagnosis. Repeating the procedure confirms the diagnosis. I want to tell now about delayed response to heat. In the late stages of pulpal inflammation, teeth may no longer respond to cold stimuli or show immediately to heat, but may exhibit a delayed strong response to heat. This is a sign of also in irreversible pulpitis. Clinically, many of these teeth exhibit non-vital tissue in the carnal pulp chamber. The techniques of this test is in chapter 7, and you will read it yourself, and if you can't understand, I will talk about it. Okay, I will explain you, and I can show you also the videos how to make these tests. I want to tell now about unexplained sensitivity to cold on posterior teeth. Many conditions can result in a patient reporting an increased sensitivity to cold in a vital tooth, including a recent restoration, occlusal trauma, exposed dentin, caries, a loose restoration, or a crack in a tooth. It's unlikely, however, that the pulp in an intact restored tooth will suddenly become responsive to thermal changes over time unless the environment in which it's situated had changed. You should ask, why has this tooth suddenly become sensitive to thermal changes? What has changed to make this tooth now sensitive to thermal changes? Okay? Root-filled teeth sensitive to cold. It's also very interesting. Patients sometimes report that a root-filled tooth is or has become sensitive to cold. Root-filled teeth very rarely become sensitive to cold stimulation. Sensitivity to cold can occur in a root-filled tooth due to stimulation of vital pulp tissue in an unprepared root canal. An unprepared root canal is not only the cause of temperature sensitivity in previously root-treated teeth. Rarely, the presence of a metallic root material, silver point, broken file, or metallic carrier inside the root canal that's in contact with a metallic filling can result in thermal stimulation of remaining vital pulp or periodontal tissues. A similar situation can occur where a metallic core is in contact with a separated file or against vital tissue in a calcified canal that has not been located. Okay, so there are very different pain conditions about temperature. About temperature, okay? Pain now when the patient goes out into the cold. It's very often that patients tell about it. Patients can report that they can get facial pain when they go out in the cold. This symptom may be either volunteered by patients or elicited by questioning. The important question to ask here is this with your mouth open or your mouth closed? If a patient experiences this pain with their mouth closed, then the pain is not dental in origin. So you understand why you have to ask right questions. The most common cause in masseter spasm or other facial muscle spasm. Some of these patients often report that they cannot drive a car with the air conditioning on or with the window open, go into the refrigerated area in the supermarket or a cold room at work, or go outside on cold or in windy day, okay? If the pain is elicited with the mouth open, drawing in a breath, then a dental problem is more likely the cause. In these cases, tooth identification can usually be made quickly by the use of cold water under the rubber dam. Note here also, if a patient presents with a complaint of pain when going out in the cold, establish whether the pain is felt with the mouth closed or open. It's very important to have the right diagnosis. Now about pain to swallowing cold foods or drinks, ice cream headache. I know that everyone had this kind of pain, okay? Ice cream headaches, brain freeze, uh, like brain freeze, okay, are experienced by males and females of all ages and occur when the patient eats something cold. They are most likely to occur on a hot day or after exercise. The pain develops in the center of the forehead supraorbitally below the eyebrows on the side of the forehead. Oh, this face on my presentation, it's so familiar when you eat ice, right? Or on the interior part of the temple. The pain is thought to be related to cooling and subsequent vasoconstriction when cold material contact the palate. Now I will tell you about pain relieved by hot pack or hot shower or by placement of hand on the side of face. Yes, patients with facial muscle spasm can often obtain relief from symptoms by the application of heat to that side of the face. This relief is of diagnostic importance and indicates that the tooth is not the cause of the discomfort. You have to ask the questions and you have to analyze all answers because you have to determine is the tooth damaged or not. No, do you need to send patient to another specialist or it's your job, okay? Muscle palpation would usually reveal tenderness in the masseter muscle, okay? You have to ask, do you get any relief by placing heat on the side of the face? Tooth pain, not only in only in every situation. Tooth pain is not relieved by the application of heat to the side of the face. Muscle pain can be more often. Do you get any relief from a hot shower? Toothache is not relieved by a hot shower. Okay, you can remember these simple questions and simple answers that will help you to make right decision when you are by your patient. And remember, I want you all remember again, ask the right question, okay? While an intraoral reaction to thermal stimuli is usually associated with pain of dental origin, there are a number of very different scenarios associated with the patient's pain response to thermal stimulation, not all of which are tooth-related. Responses to questioning often need to be broken down to subsets that help with diagnosis. With all history taking, it's important to know that what questions to ask and then to listen and analyze the response. Okay, it's very important to ask the right questions. Again, what should I ask? And you should listen. What does the answer mean? And then analyze. What else do I need to know? What is the next question I want to have an answer on? Okay, it's very important. So, as for this pain management and thermal responses, this was the presentation I wanted to share with you. And please read the chapter 7, okay? I also want you to read chapter 8. It's about cracked teeth. It's not difficult, and I will talk about this in the, during the next lecture. And did you understand everything for today? Because I want you, if you haven't learned yet, I want you all to read about reversible and irreversible pulpitis. It's very important, okay?
Doctor, is the semester online?
I guess so, because it's not a good situation. There are very huge numbers,
So we
and
don't
that's
need to go back.
I don't know. I don't have the answer. What I know is now we can we can meet online for now.
Can you please repeat, Doctor, what chapters we have for next time? Chapter 7?
For the next time, you will have to read chapter 7 and please read chapter 8. It's not difficult and it's easy, okay? Read it yourself. 7 and 8. That's right, Hussein. And did you all understand about this, what I've talked now? Was
Yes.
it kind of
Yes.
difficult for you? Was it kind of difficult? Because I don't know what you have learned. I don't know what subject did you all know and what diagnosis are familiar you with and so on. And that's why I'm interested. Because if something is not understandable, I will prepare it for you for the next time.
So today we did chapter 7, and for next time we're gonna do chapter 8.
Yes.
Okay, thank you.
Please answer. Was it difficult what I've talked about now?
No, no,
No.
it was good.
Good? You understand everything? Very nice.
Yes.
Yes, yes, thank you.
So, what I have prepared for you today now is a little bit questions and quiz, like quiz, okay? And I will share it with you. And please be
Quiz right
active
now.
and answer some questions about the topics I have talked about last lecture and topics from 3 and 4, what you had to read. Okay? Now, I just it's very difficult for me because I'm the only person who talks. It's online. It's very difficult. I want a
Okay.
little interaction. Okay, I will turn on the presentation
Have
now.
time to read the question
Okay.
and answer.
Sorry?
Yes, we are waiting for the question.
Yes, yes. Okay. I will turn on a presentation I have prepared. Just a moment.
Doctor, I have a question about the lecture. This is the first lecture I attend, and I don't have
Yes?
this, on my portal. So, do you hear me?
Yes, yes. What? It's your first lecture. Yes, for today.
I don't have the lectures on my portal. So, we are speaking about chapter 7 now.
Now,
Which,
chapter 7, and please, you should read chapter 3 and 4. Okay?
okay, which book or verse?
I will write the name of the book also. It's this book.
Okay, thank you. About this exam now. It depends on
It's not
the.
exam now. It's like a little quiz. I want to hear from you that know that you understand everything. Okay, a little keyword that I want you to learn, and then I will upload these questions for you. And please learn it. Okay, for this midterm quiz. It will be very interesting for you to read about this. Just a moment. I will upload now this presentation. No, not upload, to share with you. Just a moment. Are you able to see the presentation?
Yes.
Yes? Because I can't see
Yes, yes.
your...
Yes.
Okay, let's start. Are you ready?
Yes.
Yes.
Good. So, the state in which an individual no longer feels pain over time or feels limited pain to a normally painful stimulus. Who can tell me what is the term for this state?
Analgesia.
More answers?
Analgesic.
Be careful.
Anes-
More answers. I need more answers. I can't hear you. Don't look for the answer in Google. Please answer from the book.
Analgesia, doctor.
I've asked about the state, adaptation, in which, read carefully, which an individual no longer feels pain over time or feels limited pain to a normally painful stimulus.
Adaptation, doctor.
Adaptation. You see
Right.
the answer?
Not yet.
Adaptation. The red one, the answer. You see this?
No.
No?
Yeah. I can see it.
Yes.
Yes? Good. Now the second question. Who can read? Can you read, please? Anyone?
A painful response to a normally innocuous or non-painful stimulus.
Yes. And the answer? Who knows the answer?
Allodynia.
That's right. Very good. Now, who can read?
Increased response to a painful stimulus.
Mhm.
It's hyperalgesia.
Very good. Thank you. Now, read, please.
Reduced pain response to a stimulus that is normally more painful.
Hypoalgesia.
How, please?
Hypoalgesia.
Hypoalgesia, you told. That's right. Read, please.
Specific site of pain that can easily be identified within an organ or tissue.
And
Localization.
that's right. Please read.
Increased sensitivity to sensory stimulation presents as a heightened sensitivity to any of the 5 basic senses: sound, sight, taste, touch, and smell.
And the answer is
Dysthesia.
more suggestions? Any idea? So please read it again together with answer, okay?
Increased sensitivity to sensory stimulation presents as a heightened sensitivity to any of the 5 basic senses: sound, sight, taste, touch, and smell, which is hyperesthesia.
Yes, that's right. You will have to start with these terms and these conditions very often, okay? And these are the main terms that you have to learn. Now, could you please tell me, right or wrong? Please read and tell, right or wrong?
Orofacial pain may be
Yes.
acute or chronic. It's true.
Is it right? It's true. Okay. And now?
Acute pain can persist for months or years.
False.
Why?
Chronic persists for months and year. Acute for maximum
A few days or weeks.
Okay.
Ulcers and erosions are sensitive to touch and aggravated by acidic, salty, or spicy foods. It's true.
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 The most common cause of non-odontogenic orofacial pain is masticatory muscle pain.
True.
True.
True. That's right.
Superficial breaches in the epithelium which appear reddish in color and may be covered by a yellowish exudate.
What could it be? Who knows the answer?
Ulcers?
I think it's true.
Not true, but
Doctor, what's the difference between
Taste or-
ulcers and erosions?
yes, no, we will read it.
Okay. Open sore, generally yellow or grayish in color, surrounded by an erythematous margin.
Ulcer.
Mhm.
Which is the largest paranasal sinus?
Which is the largest paranasal sinus?
The maxillary sinus.
Yes, that's right, the maxillary sinus. Okay? Oh, that's all?
Questions like these are going to be in the midterm.
Yes, a little bit change, maybe I will change something. How did you like the quiz?
They are good.
They're good?
Yeah.
Now I will upload. These are the main terms that I want from you to know, okay? And I will upload, and you learn them very properly. Read them again, okay?
Okay, and can you please every time do the same thing?
Sorry?
Can you do every time the same thing? Questions?
Yes, I guess so. It will be very good for you to understand the topics like this.
Yes, so that's more
How do
main
you see it?
terms.
Sorry?
It's informative.
Yes, I guess so. And you all then have what all you have read, you will have in mind. Yes, the main topics and main terms, they will stay in your head. Okay, it's a
Yes,
little
true.
difficult online to learn because you don't have patience, and I can tell you on it's pain like this or on the tooth, and I guess this method will be very effective for you. Okay,
Yes.
I will upload all these materials together with presentation and this quiz. I guess not today, and maybe tomorrow. I will ask Salome, and she will help me to do it. I haven't made this. Okay. Have a nice day. Be careful. Stay healthy, and wear mask. Okay.
Do you think we have a practicals?
Okay.
I don't know. I can't tell you anything now.
Thank you.
Doctor, but the university is not responding to us. We sent 100 emails and they
I
didn't.
guess that they don't have decision yet because decisions are changing very fast, and they don't have answer yet. Maybe that's why. Because in the other medical university, state medical university, they don't know what to do. Maybe yesterday the students were going to lectures. Today they were not going to the lectures, only to practicals. I don't know, because everything is changing. It's up to the situation, epidemiological situation. It's not very easy. Okay, so we're done for today.
Thank you, Doctor. Goodbye.
So read please
Thank
chapter
you.
7 and 8, and we will meet next Monday. 11 o'clock is fine for you?
Yes.
Thank you.
Because my daughter is also online classes from 9 o'clock, and I don't want to cross with her. And that's why if it's okay for you, we
Yeah, no
will meet.
problem. 11 is good.
Okay, thank you so much.
Thank
And
you.
have a nice week.
You too.
Bye.
Bye.